just like to welcome Philippa, Vanessa and Jason this evening from the Disc Trust, and looking forward to their presentation on how we keep safe with this needle exchange program and other initiatives. Before I hand over, I'm just going to open the meeting with karakia so we gather our energy to focus on this topic tonight. So me karakia te whānau, whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina tiuta, kia mā taratara ki tai, ihi aki ana te atakura, hei teo, hei hoka, hei hauhu, ti hei, Māori ora.
Māori ora. Thank you.
So without further ado, I'll hand over to Vanessa, Philippa and Jason. They can introduce themselves and run us through the program tonight. We've got a Q&A session at the end, and you can either add your questions through the chat, or if the group remains quite small, just raise your hand and we'll go to you for the question. So thank you. Over to you guys.
Cool. I'll start sharing my screen.
Thank you, Grant.
Our presentation.
Well, my name's Philippa Jones. Kia ora. We're really pleased to be here tonight. Thank you for hosting us. And we've got a few slides to run through. I've been with the overall needle exchange program for 5 years, and came from a background in mainly in the public sector, in social housing, health, and tertiary education. Oh, make yourself. Next.
Kia ora, I'm Vanessa Watson-Love. I'm the Service Manager of Community Health. I've been at DISC almost 2 years, and I come from a public health background. Kia ora, thanks for having us tonight.
Kia ora, my name's Jason George. I'm the National Harm Reduction Lead here for DISC Trust. I've worked within the needle exchange program for a little bit over 20 years in a few different roles in Wellington and now based in Christchurch, overseeing our drug checking services and involved with the needle exchange program and a range of other things.
Great. Well, I'll just start with a few slides. So we are DISC Trust, where the words DISC are a bit out of date because they relate to a legacy trust, and it stands for Drug Injecting Services in Canterbury. So clearly we're not ownership. Below in the words there, that is our kaupapa, is to enhance the health and wellbeing of people who inject and use drugs by providing leading harm reduction practices. And DISC Trust has been around for 35 years, so we're a highly trusted service amongst a group of the population who are heavily stigmatised. So this is why we exist, to support the health and well-being of people who inject drugs and to uphold their human rights, health and dignity. We are an independent peer-based service. So when I say peer-based, because that term is used quite widely, we're talking about people with lived and living experience of injecting drug use. And so our staff, 95% of our frontline staff have that lived experience, and it's that particular experience that enables the clients to have trust in our service. So that's a really important component and feature of our service. A lot of what we're doing is about reducing stigma and removing barriers. So we're a low threshold, community-based, peer-led service, which makes it easy for clients who are otherwise, often challenged in trying to access healthcare. But in our environment, we regard ourselves as the trusted front door for this group of people. So we're also about building harm reduction knowledge and understanding in the community, and so this is a great opportunity for us to sort of spread the word. So just to give you a little bit of an overview of our services, although we are based, we're all based in Aotearoa, Christchurch, but in fact we run services right across Aotearoa. We have 7 needle exchanges across Te Waipounamu and a mobile service that we run. That's the photo of the service there. That's our custom-made van called Rereto. And in that van, we get out all over the South Island doing Hep C, HIV and STI screening, as well as the distribution of harm reduction equipment. So we are, in terms of hepatitis C, we are one of the leading providers in New Zealand. We have the highest test and treatment rates in the country around Te Waipounamu. And for the last, we've been running those services in the South Island for 16 years. And more recently, 2.5 years, we've been operating in Te Tai Tokoro, a peer-led harm reduction mobile service where we work closely with mana whenua. And we've just recently been appointed as the regional provider for Hep C services in Te Manawa as well. And we do those 2 services in Te Tai Tokoro and Te Manawa in partnership with Odyssey Northern, which is the reason why we're up in Auckland today meeting with them. So those that's a new service that we're setting up. We are based in the Roger Wright Centre in Christchurch, so there we have a clinic, Hep C clinic that's been around for 16 years, which Vanessa oversees. We're also recently been awarded, we're one of the contract holders for the HIV and STI screening that's just recently been awarded, and we'll be looking after the Te Waipounamu region. We also deliver national drug checking. That's the service that Jason leads, and we have a base, sort of a permanent base in Ōtepoti, Aotearoa and Te Whanganui Atara, as well as doing periodic services in Nelson, Palmerston North and Hawke's Bay. But more on that later. And we currently lead the National Pharmacy program. We have 200 odd pharmacies are part of the Needle Exchange program and distribute harm reduction equipment. So our approach to harm reduction is about being the trusted front door. So at the bottom of that picture there, that's sort of to illustrate our trusted front door. It's led by people with living and lived experience of injecting drug use who can relate to the people who are wanting support. But our goal is to use that front door as a way to introduce clients to other services that they need and are looking for, whether that's just peer support. We do a lot of wound care. We provide broader health services now, both in Ōtepoti and in Ōtautahi. We deliver the drug checking. We provide referrals to other services. And we provide advice, for instance, on safe injecting practice, injecting related injuries and diseases. So we're really saying that front door is trusted. For many of our clients, they don't want to go to other services or don't feel comfortable or have experienced stigma in other services. So why don't we add those elements to our service so that they can get that support at the same time? So non-judgmental harm reduction approach. I'm going to let Jason speak to this.
Okay, so this slide sums up basically what harm reduction is all about. It's a practical, evidence-based approach to reduce the health and social and legal harms related to drug use and to the policies and laws that surround it. So harm reduction is really, it's grounded in human rights and social justice and focuses on supporting people without judgment or coercion. So without coercion to give up or stop using or reduce using drugs. So essentially we're meeting people where they're at, helping them stay safer and working towards positive change. And this slide sort of goes on to capture some of the meaning behind harm reduction to our staff, our peer staff, people with lived and living experience of injecting. So yeah, that's just some of the key points that we've that harm reduction really means to us, particularly the nothing about us without us sort of saying, which essentially means that people that use the service or people that are affected by services should be involved in what services look like, evaluating services, designing them, just all aspects of the service. The community should have input to. So this slide highlights why peers are such a critical part of harm reduction. People who use drugs are simply more likely to open up to someone who's walked a similar path. Peers bring practical, lived experience that you just can't learn from textbooks. So this sort of insider knowledge helps make services more relevant, more responsive, and more trusted. Peers really help break down stigma and power imbalances. And when clients see someone like them not just surviving but thriving, it can be incredibly powerful and motivating.
We prepared some material for another reason recently, and we just thought we'd share this with you. We've got a sort of a snapshot of each of the 4 Te Whatuora regions, just to give you a little bit of an overview of what each region looks like through the lens of injecting drug use in Hep C. So this is the northern region, and up the top right-hand corner you can see the ethnicity breakdown. So around 68% Pākehā, 21% Māori, engaging with the services in that region. And in the bottom right corner, you can see the range of the drug use. So we ask a question on when clients come in. We don't collect personal identifiable information, but we do collect some demographics. And we always ask, what drug are you using today? So we start to get a bit of appreciation for what the drug use pattern is, and it's very different by region. So in the northern region, we have 4 needle exchanges and an electronic dispensing machine. And we can see there that 30% of the Hep C treatment rates have occurred in this region as a percentage of all treatments over that period of time. And a little breakdown on the number of pharmacies in the program there as well. If we just move down to the next one, so this is Te Manawataki. Again, or here up in the top right-hand corner, you see a higher percentage of Māori. You also notice from this that the Pacifica and Asian communities are quite small. That's something that we've taken a bit of time to investigate and work with partners in the sector like the Asian Family Services to see if we can understand that better. Again, the bottom right, you can see the drug use patterns in that region. This is a big physical region. It's quite a large area after Te Waipounamu. It's the second largest, 21% of New Zealand land area. And of course, that's important because for many of our clients, they do live rurally. They live in smaller communities and they're remote. And so reaching those people in those communities can be challenging. And that's where mobile services come in. You can see here that only 16% of the Hep C treatments have occurred in this region. So this is the region that we will be working in with Odyssey to deliver the Hep C service going forward. And we hope to bring some of our experience and successes from other regions to this one. Just flick down, we can always go back to these and share these with you. The central region, you can see 5 needle exchanges and a mobile service there. And again, a breakdown of ethnicity and the drug use in the middle, down the bottom right-hand corner. In the middle, you can see that purple circle with the syringe. The World Health Organization has a recommended number of needles per year per individual as a sort of a baseline target to ensure that enough people are getting clean needles. they're right on target. Some of the other, well, they're just below the target, but some of the other regions are quite a lot below the target. But if we move to the Te Waiponamu region next, you'll see in the centre, just to draw your attention to that centre, there's this region, which we are responsible for currently, distributes about 42% of all the needles across the country are distributed in this region, which, you know, while it might have a smaller population, it has got a big landmass and a lot of you know, a need to reach people in rural settings. So there's always traditionally been a high number of injecting drug users in Te Waiponamu, and that's sort of played out here in these figures. And we're happy to come back to any of these slides. Back to you, Jason.
Okay, so this slide really sort of captures the public health value of needle exchange services and harm reduction services. So essentially, we start from an understanding that in every community across Aotearoa, there are always have been and always will be people who use drugs, and our job is to help keep them and everyone around them safe. So needle exchange is a harm reduction program that provides not just clean equipment, but or particularly with Disc Trust, we provide more than just clean equipment. We provide a wide range of essential health services, from Hep C testing, peer support, wound care, drug checking, and this is highly effective in reducing the spread of HIV, hepatitis C, and also addressing some of the broader risks people face in today's drug market. It works, it's very successful. Research by the University of Canterbury found that for every $1 spent on the National Needle Exchange Program, that our health system saves $6.79, so nearly $7 in avoided costs, which includes things like, you know, treating bloodborne viruses, infections, and injuries that would otherwise occur. So this isn't just compassionate, but it's also very cost-effective and evidence-based public health. So in 2022, we did some research with the University of Auckland School of Pharmacy, which this was in response to the sort of growing cohort of clients using performance and image-enhancing drugs. So we looked at sort of a staff knowledge of these drugs, and because most of our staff have a slightly different lived experience of drug use, we found there was a little bit of a gap in this area. So we did some really good work to try and provide staff with a bit more information and knowledge in response to this growing client group. And yeah, as you can see from the figures there, there's been really significant growth of people using steroids and various other performance and image enhancing drugs over recent years, and it's likely to continue growing in the future. So yeah, there was a real need for us to upskill staff and equip them with the knowledge to meet the needs of these clients. So we also did some research in partnership with the University of Otago Medical School. We surveyed a bunch of clients and interviewed some staff as well, both in Christchurch and the needle exchanges. We found that it was quite significant. Over 40% of clients had experienced more than 10 injecting related injuries. So infections and abscesses, soft tissue damage, that sort of thing. So we basically found out a little bit of other information from clients, and as you can see, that's 60% had learned from needle exchange staff. At 77% said they had learned about how to prevent injecting related injuries from peers, so other people in the community. And just over half had learned from some of the resources that we produce. So just a really good example of people who are using or injecting drugs, listening to other people from the community, which just really underscores the importance of using living experience in these services and why they're so effective.
Thanks, Jason. So I'm just going to talk a bit about Hep C in Aotearoa. It's very fitting. On Monday, the 28th of July, is World Hepatitis Day. So you may see in the media some information and some stories about World Hep Day, and the campaign here in New Zealand is Stick It to Hep C. That's the Ministry of Health campaign. So the really interesting thing about Hep C, bloodborne virus, there is no vaccination for it, but there is a cure. There's a miracle drug called Mavyret, and it has about a 98% cure rate. 3 pills once a day for 8 weeks with little to no side effects. So that's a change that's come across in about the last 10, 15 years. And the old treatment was really, really horrible for people, side effects. So we're trying to get the message out there, stick it to Hep C, easy test, easy cure. And why it's really important is about 20,000 people in New Zealand don't know they have Hep C. And that's because it has little to no symptoms. So most people don't know they have it. People can have it for 5, 10, 15, 20 years without knowing. And suddenly 15, 20 years later, they feel unwell, and it turns out they have liver cancer. So it's a very slow progressing disease. Risk factors include people that have injected drugs. So that's where obviously it's part of our kaupapa here at Disc Trust. But, any reason that someone could share, come in contact with some other person with their blood. So prison, tattoos, people on the rugby field. We test a lot of people that are doing MMA fighting and boxing. But the biggest thing is there's this huge stigma around Hep C. And that is really difficult when you're trying to find those 20,000 people, because, somebody that injected drugs maybe 10, 15 years ago isn't going to tell their, GP today that, hey, I might need a Hep C test because this was my life, 10, 15 years ago. So there's still a lot of that stigma around it. So we just really try to promote it as a general health screening, as part of a bloodborne virus, a full health check. We think it's really important. If you're checking for one thing, checking for Hep C, Hep B, HIV, syphilis, that full bloodborne virus screening is really important. And another thing that's really great about the treatment of Hep C is Mavyret, that miracle drug I spoke about, has been reclassified. So pharmacists and nurses can work together to actually dispense that for people. So again, it's removing a barrier for people so they can access treatment. So next I'm going to play a really short video. It's about 6 minutes long, that talks about our Hep C program. It features Philippa and Jason and I in it. And I think it will give you a really good sense about Hep C and the treatment and some of our work we do.
We haven't got any sound. Can others hear that? No.
Oh,
Vanessa, we
sorry,
haven't got any sound.
Oh, okay. I might just need to. Well, what I might do is I can send the video out so everyone can watch it later if we're having a bit of technical issues instead of playing around with that. So I will just skip over that slide, but the Hep C video is really, I think, really beneficial to show, and it can be a great tool to show to students or anyone that's just move to the next slide. There we go. Okay, we're back on. Okay, so yeah, sorry about that. We'll share the video out later. So I just wanted to show a story from our Te Tai Tokoro Northland Hep C service. And I thought this was really great to show, obviously being the Rural Health Network. Part of what we do is having this peer-led, nurse-supported outreach services. We go into the community. So that's why we have a really high success rate for Hep C testing and treatment. We're in the community, we go to people. You guys would know, challenges that people with rural health face with getting to appointments and, traveling. So we come to them, all of our 3 services that we support in, Te Waipunamu, Northland, and Te Manamataki. We all have an outreach van. So it's really, important to be in the community, and, the peers lead the testing, and, meeting people where they are, as Jason said. And that's why we have really great success rates when it comes to Hep C. So, all right, I'll just pass over to Jason to talk about our drug checking service.
Okay, so yeah, we're one of 3 licensed drug checking providers in New Zealand. The New Zealand Drug Foundation, Know Your Stuff NZ, and us are licensed to provide drug checking services. Our services, drug checking services, are peer-led, peer-run. We don't just check samples for people, though. We are providing sort of tailored, personalised harm reduction information and advice to people who get their drugs tested. Our service, we run the only what's called a continuous drug checking services in the country, which basically operate 5 days a week in Wellington and Christchurch, 4 days a week in Dunedin, where people can come in without an appointment, get their stuff checked, and get a result right away before they leave. We also provide drug checking on a sort of periodic basis in other locations in the lower North Island and across the South Island. We're also licensed to provide mobile drug checking services, so we can provide drug checking out of the van that we use in the South Island here. So in the 12 months leading up to May 2024, we checked 3,329 samples, and in the 12 months to date, so that sort of the 12 months since then, we've checked about another 4,500 samples. So when people find out their drugs were not what they expect, there's 63% of people tell us they would not take them. Some people still might take them, and that can be because they're still desirable, or some people will take them, or might because they're still either another drug that they think is worth taking, or yeah, that's generally the main reason. When people find that their drugs are completely substituted and not as they expect, we actually sometimes even destroy drugs for people. We have a sort of, we call it a jar of destruction, and we pump unwanted sort of drug samples in there to make them completely unusable. And certainly clients tell us that they often go back to the suppliers and provide feedback to their dealers when the drugs are not what they're supposed to be, or if they contain harmful other substitutes or adulterants. And we believe it is having an impact on the drug market, because it's making it harder for people to get away with selling dangerous substances or just rip people off. So that's certainly having a positive effect. So absolutely everybody who comes into our service has the opportunity to have a harm reduction conversation. People don't have to take the harm reduction advice, but it's certainly available to everyone, and we try and sort of impart information to people based on their level of experience with the substance and drug use. We can talk to people about dangerous interactions with other drugs or with common pharmaceuticals, and share information with people on ways that they can basically stay a little bit safer. So it's absolutely, it's not just telling people what's in their drugs. A huge part of it is the information and the conversations we have with people. Lots of clients actually say to us, well, this is the first time I've actually had serious or real conversation about my drug use with a health service or with another sort of adult about the way I'm using my drugs. So it's very, very effective in that regard. It's a couple of stats there from some of the conversations we capture, which also shows that people after using drug checking services, so these are some of the things that they say they do. So quite a few people decide to get other drugs tested, and of course not everybody. We don't get this information off everybody, so the actual percentages will be much higher. But it's just some of the impacts that we've captured from people using the service.
Great. All right, and that's us.
So we're happy to take any questions or go back to anything that we've covered and fill in any gaps. So over to you, Grant.
Yeah, thank you. And if people have got questions, either let us know or put them in chat. Are all the services free?
Yes. Yes.
Okay, yeah, that wasn't quite clear. So these are Health New Zealand contracts, are they, to provide these services?
Yes, they are all Health New Zealand, but from different parts of the commissioning. Some are regional, some are national, some are from within addiction commissioning, some are from within other parts. Yeah, population health, etc. Yeah, so it's a variety.
And are you seeing trends in the types of drugs? I mean, I noticed that methamphetamine is by far the biggest drug use, and you noted that the performance enhancing drugs were increasing in the South Island. What trends are you seeing across New Zealand?
Well, I mean, methamphetamine use is on the rise, and as we've been seeing news recently about the amount of meth consumption increasing, so that's been very consistent. We have also more recently been seeing more cocaine being available and becoming cheaper. So there's more and more people using cocaine. There's more people injecting ketamine. Ketamine use is on the rise, and as a result of more people using ketamine, we're also seeing more people injecting ketamine. And that's sort of also happening globally. So New Zealand's sort of following on with that trend. Possibly one trend that's a little bit more concerning for folk might be that it's sort of we identified it was a risk probably about 5 years ago, but now we're starting to see it play out. There's been an increase in the availability of imported heroin. New Zealand's historically had a pharmaceutical-based heroin scene where people purchase morphine and they make the heroin themselves, but they're sort of dealing with a known quantity of morphine, and it becomes a reasonably predictable amount of heroin. Whereas now with imported powdered heroin becoming available through face-to-face drug dealers, but also the dark web drug markets, there's potentially a whole batch of newer, younger consumers starting to use heroin who are not from the traditional sort of opioid using crowd. Who so there's some of these younger people are potentially getting into it. They don't have more experienced users around them to help guide people through and stay a bit safer. So I think there's quite a risk that heroin use is going to keep increasing, particularly as it's cheaper than methadone or morphine, and with people able to easily access it online domestically from social media and dark web drug markets.
Interesting. I see Jenny in the chat has put the comment that 1-for-1 needle exchange is free, but she thinks people have to pay for some gear from the pharmacies. Is that still the case?
No, it shouldn't be. There should be all of the equipment that's available, including through the pharmacies, should be being given free. And that changed about actually nearly 2 years ago. So that would be a concern if that's happening. And we have heard of the odd one because we manage that program. We are constantly reminding pharmacies that it's about providing all of that for free. So what we did change a couple of years ago was the way in which what pharmacies distributed. And Jason, together with one of our other team members, designed 6 pre-made packs that pharmacies distribute. And some really busy pharmacies also have some loose equipment. But Jason, maybe just a brief overview of those 6 packs, because they're designed around specific types of drugs.
Yes. So the pre-made packs, there's essentially a sort of the idea was that there would be a pack that sort of caters to everybody. So there's a pack with a larger syringe, and that would be more tailored to maybe people using methadone. There's some a pack with smaller syringes tailored to people likely to be using methamphetamine. There's a pack with some larger needles for intramuscular injecting. Essentially there's a sort of ideally someone should generally be able to get what they need out of one of those packs. Probably just also worth mentioning, if you're sort of familiar with the old 1-for-1 program, more broadly though, is that we used to only have a very limited selection of equipment available on the 1-for-1 program, but now under the free program that people can access at needle exchanges, is all the syringes are free, all the needles are free, you can get filters for free. It's a much wider range of free equipment. And also at the pharmacies, the packs should all be free now. So it's people wherever they are should be able to access free equipment so long as they can get to a needle exchange or pharmacy partner.
Thank you. So for those in rural areas, how often and how close does your van or your people get? How often would they be circulating through more rural areas?
So, for example, our here in Te Waipunamu, we have a West Coast service that's once a month. So our outreach van goes over to the coast with equipment, with, you know, our Hep C screening, and we actually go to people's homes. So we've been running that service for about 15 years. And other rural places, you know, with our outreach van, let's say, goes down to Otago, where we've been down to Balclutha, to Bluff, to Te Anau, and more recently, you know, the van was up in Nelson, and Jason was doing a drug checking clinic there. So we try to make it a priority to get to rural areas. It's really important to us. Because we know that the excess, you know, people can't just drive a few hours to a big city. And I think what's also, I'll maybe let Jason or Philippa talk about, is I think there's always a, you know, spirit of looking after people in rural communities. So, you know, someone that does travel to the exchange and have those peer relationships. So some of our peers have been with the exchange for 28 years. So they know of someone that lives rurally, and they'll try to support them from afar the best we can as well.
Yeah, and in Tito Tokoro, we have it's just a mobile service, so there isn't really a static location, and that service operates, works in partnership with a really wide range of addiction, mental health services, public health services, kaupapa Māori services. So really, they just go out into the community and work alongside like-minded organisations to sort of, you know, work together on health promotion and where necessary, provide that harm reduction equipment as well.
So if you're visiting those rural areas once a month, are people able to get a bulk supply to last them that period of time?
Yes.
Okay.
Yeah. We don't place within reason restrictions on the equipment. So we know our clients, even clients who might come into our static exchange, for instance, service, who we know might only come every couple of months. We'll, you know, our goal is to ensure they have what they need. So as opposed to in the older days when it was sort of the one for one, really what we're asking people is, what do you need? Yeah.
That's great.
Yeah, and everyone also gets a returns container, a sharps container. So, and even with our mobile service, we have a wheelie bin in the back that's for a safe disposal. So that's also really important, that, you know, it isn't that one-to-one, but we make sure that everyone has a way to safely dispose of things. And then when they come to the Neil Exchange, they can put it in our big bin. So that's a great thing that we promote as well.
Right. And in terms of, Jason, you were talking about the trends in drug use. Is the increase because of availability and cost? Is that the main driver, or is it people seeking a certain type of high or experience?
Yeah, I think availability and cost is a big factor. You know, customs are dealing with, you know, more and more seizures constantly of bigger volume. So we know there's, you know, more attempts to bring large amounts of drugs into the country, and you know, over recent years with the several, you know, motorcycle clubs having set up in New Zealand with international networks, we know that's sort of directly contributed to an increased flow of drugs coming into the country from overseas. So that's a big factor. I think you know, people also are looking for particular experiences or for new experiences, and I think yeah, so there's a range of reasons, but they would be some of the main ones.
In your drug ID facilities, do you go to concerts? Are you one of the groups that go to concerts and do that testing for people?
So we generally don't do the concerts. We'll go to the concerts or festivals. But what so Know Your Stuff and to a lesser extent the Drug Foundation focus a bit on festivals and events and concerts, that sort of thing. What our sort of key approach to those is actually bring your stuff in before the concert or the festival, get it checked, so you know what you've got when you get there, and you can spend your festival having fun instead of queuing up to get stuff checked. So in the days leading up to festivals and that, we often see a bit of a spike in people coming in leading up to the event and getting things checked in advance. But there's the need for both before the festival and at the festival or concerts, because some people get things organised at the last minute or even at the events and need to get it checked. So we have quite good coverage, both before and during the events by our sort of different areas of specialty, and how we focus delivering services.
Cool. So the rural health professionals who may be viewing this video in the future, if they want to direct people to your services, is your website the best place to point them?
Yes, we have our Disc Trust website, which is specific to us, and then there's also the New Zealand Needle Exchange Program website. So there's two. One is sort of at a national level, which has sort of broader information, and then our one is specific to our services around Aotearoa.
We also have a Facebook page as well that has events, upcoming places that we're going to be with the outreach van, and we're really open to collaborating with different services. So if anyone, was listening and thought that, sounded really cool, we'd love to get in touch and come out. So if you, wherever you may be, just be in touch, and we would love to come out and support. That's a big part of what we do, is going to the communities that need us.
Thank you. Well, that's amazing. And I see you've put a link to the video in the chat. And when we edit the final video, we'll paste that onto the page where you tried to show the video, but unfortunately we had sound problems. So we'll get that sorted.
Thank you. Thank you.
That seems to be the questions for tonight, but it's been great. I really appreciate you making your services known to our team, and we'll make sure this goes on. So thank you very much, everyone. And I'll just close with karakia. Kia tau mai te manaki o te wahingaro, mai runga, mai raro, mai roto, mai waho, hui e tā kie.
Yeah. Thank you very much. Everyone.
Thank you.
Have a good evening. Take care.
Yeah.
Thank you.
O Maria.